here now with what's behind it and what you can do about it. This is really troublesome. A lot of people are like, okay, great, flu's over, cold's over, but why isn't this cough going away?
And so many patients have that question. They come in and their cough is sometimes lasting more than 4 or 5 weeks, which is definitely a concern and should be worked up. But I think it's also important to describe what is happening. And this is how I describe it to my patients. You know, here is an example of a clear airway. You know, we have small air sacs in our lungs. They help exchange oxygen to our blood so that we can get the air that we need. But during this cough season, you have a buildup of mucus and irritants. And that stimulates what we have, cough receptors in our chest, and that causes the cough reflex. And many things can cause that buildup of mucus. Common things being common, viral illnesses, but also acid reflux, allergies, asthma, things of that sort can all increase your buildup of mucus. So it's about figuring out what's the cause.
What do you think is the cause that this year we're seeing it so much more?
You know, I think a lot of the causes are the viral illnesses that we're seeing. We're seeing increases in flu, RSV, and COVID. So of course, common things being common, but I also never forget to think about the other causes when I'm evaluating a patient, because you just never know.
Okay, so let's come over here. Some people have been dealing with this cough that lasts for weeks on end.
Yeah.
What's normal, what's not normal?
So I think that this calendar really helps to illustrate how we are thinking as physicians when you're talking to us about your symptoms. I'm thinking about how long has this lasted, and I'm labeling how chronic you are based off of the time period. So I would say the first 3 weeks are the typical viral season. So that's the typical time where you're going to have that cough. It can sometimes take up to 3 weeks to get that cough over.
Weeks.
And then after that, the 3 to 6 week mark, that's what we call subacute. That's the time when we're a little bit more investigative. We're doing imaging. We're trying to figure out what could else be the cause, but it can also be something called post-infectious, which is just your lungs healing. And then down here, after 8 weeks, that's something called chronic cough. And that's what needs an additional workup, including imaging and sputum testing, and just trying to figure out exactly what could be the cause.
All right, what can we do at home if we're having that cough that's just so irritating? Simple remedies.
So simple remedies that you can find in the comfort of your own home. Of course, we all have been taught from a young age that soups and broths are helpful from our parents, our grandparents.
True or not true?
It is true. It's absolutely true. Our grandparents can definitely help us solve that. You know, you have your teas, your honeys, even eucalyptus oil. If you put it in the warm water,
good. I smell it right here.
It smells fantastic. Or you put it in your vaporizer, a few drops to help clear your airway. It can be an anti-inflammatory, and it can make you feel a lot better.
I do that sometimes for the voice. It really does work.
Same, it does, and it helps keep you from becoming hoarse.
Yep, exactly. Okay, so that didn't work.
Yeah.
Now let's talk doctor. When is it time to say, you know what, it's time for the docs?
So, you know, personally, I think that after 3 weeks, you should get an exam. You should get some type of imaging, and then after that, that dictates what the intervention is. Some people find benefit in over-the-counter medications. The only thing I'd say to this, Lara, is that these medications, although they may help your symptoms, they're not going to change your outcome.
Right.
And so you might need additional interventions like steroids or albuterol inhalers, and that it only comes after a formal exam and a workup.
Yeah, it's frustrating, it's annoying, and sometimes painful. So,
really
and I know you all are dealing with it a lot this year. So thank you. Really good information.
Of course.
Dr. Sutton. We're going to head over to Ginger.